Good afternoon, everyone. I'm Vicki Janowski, editor of the Greater Wilmington Business Journal, and thanks for joining us on this week's Wilmington Biz Talk. Today, we will have the New Hanover County Health Director, David Howard, joining us to give us the latest on where cases stand with COVID-19 and on the Delta variant in general and what they're seeing from the public health standpoint. But before we jump in our conversation with David, feel free to think of some questions, put it on our live stream feed right now on our Facebook page, and I will keep an eye on those and pass them along during our talk this afternoon. And before we start, here's a quick word from our sponsors, Cape Fear Realtors.
Hello, I'm Ann Gardner, CEO of Cape Fear Realtors. Realtors support this program's efforts to connect our community in meaningful dialogue with actionable insights. Realtors are dedicated professionals who build strong, resilient communities and businesses. Work with someone you can trust. Work with a realtor. Learn more at capefear.realtor.
So this week we are again talking about COVID-19 and the Delta variant in particular. And one reason we wanted to focus on this topic for this week's Biz Talk and to invite New Hanover County Public Health Director David Howard on is because there's been a lot of developments in the past week or two that are based around policy changes, primarily because of the Delta variant. We've seen large employers, including Novant Health, which now is our largest employer in the region, turn to mandatory vaccination policies for its employees. By the way, a move that a group of Republican legislators just today wrote a letter on, urging them and other major health systems that have followed suit to rethink that policy, so causing some discussion around that. We saw the New Hanover County School Board this week vote to reinstate masking policies when students return to classes later this month. And we've seen the higher education institutions, UNCW and CFCC, also put in place masking policies for when students and staff are indoors. So a lot of things happening and changing as people are watching the cases rise because of the Delta variant. And many of these policies are being attributed to the health cases and the health numbers and pointing to what the officials are seeing in terms of vaccination rates, but also positivity rates. So that was one reason why I really wanted to talk to David Howard today. These health statistics are being pointed to for policy changes that are affecting how we move about every day, maybe how our businesses are deciding to operate as well. So let's get into those actual numbers, which I know might not sound like the most exciting thing to talk about right now, but health metrics really do seem to be driving a lot of the discussion and changes that we're seeing. So David, thank you for joining us today. And just kick us off, tell us where, particularly Southeastern North Carolina, where are we at right now in terms of this just ongoing issue we've been talking about for over a year now?
Right. So in terms of the virus itself and the transmission, and I hope you can see me now, Vicki. I think I fixed that. So great. Okay. New Hanover County in particular has evolved. Remember, we dropped to a low level of transmission. We have over the past, I guess, 3 to 4 weeks, really grown back to a level of significant and high transmission. What that means is a rate of transmission measured by percent positives that are found among testing that is happening, which really we believe is quite low among the number of cases out there. What that means is maybe 20% of the people who are actually positive are actually getting tested and giving us data on that. The other metric is simply the number of cases that we count, number of hospitalizations. So the activity has increased greatly. As you mentioned, we believe that's mostly due to the Delta variant. For 2 reasons. It has arrived, but in neighboring counties, it arrived first, such as Bladen. They reached high and significant levels of transmission before we did. And that came all the way from India. So it took a while to get here, but it's a variant that travels faster. For whatever reason, it's more easily transmittable. It infects people a little easier, better, you might say, and is transmissible to other persons much better. The estimates are the original coronavirus was 2 to 3 people you might infect if you were positive. The estimate for the Delta variant is more around 6 people under typical circumstances. So it's just better at getting to other people, which is typically what viruses like to do. They like to spread. And by random mutation, these variants get better at doing that, and they outrun basically the other variants or the original virus. So that's what's happening. Our numbers are percent positive is way back up to 7-8%, whereas we had dropped to 1 or 2%. The immediate concern is the stress on the systems, the hospital system, but also everyone's business. When people get the virus, they may not get sick. They may not know they have the virus unless they get tested. But if it's transmissive to 5, 6, 7 people, 1, 2, 3 of those people will become symptomatic and they're out of work, and it starts to interrupt. And we're already in a situation where a lot of folks are looking for labor, and so it adds an interruption to operations, both for individual employers but also across the board, suppliers, et cetera, et cetera. So that's where we are. One of the aspects of Delta is that we can expect it to burn faster. In other words, people in the UK have experienced a significant drop already in the number of cases because the Delta variant burns very rapidly through the population, like wildfire unchecked. No firefighters, nothing going on. The cost there, though, is literally lives. A lot of work time lost, a lot of interruption to other aspects of our life. So the response that you've seen from CDC and the governor and local employers, and as we go through time, local governments, is to reinstitute protections. So there are protective measures, masking, distancing, reducing the need or frequency that you meet face-to-face, that kind of thing. And then pushing the vaccine, because the vaccine is actually the answer. Hypothetically, we thought we would be out of this by now because we've had 8 months of vaccine availability. If, pick a number, 75, 80, 85% of the population had been vaccinated by now, we probably wouldn't be dealing with this, even if the Delta variant still arrived, because it would have still arrived from India to Europe, to the US, et cetera. Even if it still arrives, the impact is much less. So that's where we are now. Unfortunately, we're having to react relatively aggressively to protect a lot of different systems, but also people from the Delta variant.
So about those vaccines, what's the overall trend that you're seeing on just that end? Or is New Hanover County similar to what we're seeing in other parts of the state, other parts of the country, where vaccination dose levels really kind of tapered off and hit a ceiling? And some places now are seeing an uptick in that because of the concerns over Delta, is what's being reported in other areas. Is that on track with what you guys are seeing here in New Hanover County?
That's correct. Vaccination rates peaked, I think, in May. Remember, we went through those stages of populations, the elderly, the healthcare and elderly first, the most vulnerable to either interruptions or health concerns. And then in May it peaked, and then I think a lot of people lost interest. What we've heard and what we've seen to some degree anecdotally is that mainly 2 camps. People have moved on. They're not necessarily against the vaccine, but they're busy. They moved on family work, obligations, summer vacations, what have you, and trying to get back to what they were doing before. A lot of businesses may be very busy trying to recoup and reanalyze and rebuild their business. We would ask those folks to find a little bit of time, if you're not really against the vaccine, to go get it done. Check it off the list. It will help. It will help you, everyone around you, your workplace, and the community finally move past this. The other camp is those people who are truly, for whatever reason, decided definitely not to get the vaccine. We also asked those folks, given we've had 350 million doses given so far just in the US, 7-8 months of experience with the vaccine, take another look at the data, the safety data. The last number I saw, which was quoted in Novant's release around their requirement for employees to get vaccinated, the chance of a serious adverse event from the vaccine is 0.0005%. We think the chances of getting sick, $100,000 hospital bill, what have you, from the virus is a much greater risk than anything you might be risking with a vaccine. No vaccine is perfect. The vaccine doesn't protect you from getting the virus anymore. You can still pick up Delta and spread it, but it absolutely is fantastic at keeping you out of the hospital, keeping you from getting super sick. And it may turn out to prevent some of those long-term effects. The sicker you get, the more likely you may have long-term effects from the virus.
Yeah, and I know those employer policies, they are very, they're causing a lot of debate. There's a lot of strong feelings around either side, just like many of the issues that have come out the past year around COVID-19. That's another development I wanted to ask you about. So earlier this week, the county's health board, you're the health director, but the governing board for the agency. So I know I'm not that you can speak for the health board here, but just wanted to see if you had any updates on the request they sent to County Manager Chris Crugere to call for all county employees to get the vaccination. And if they were not going to get the vaccine, then to undergo regular testing, similar to what the state had put into place out of DHHS. So that was a request put into the county. Has there been any updates on that in terms of whether the county is going to take it up or move it on to the commissioners to decide?
So anything like that. So first of all, if people don't know exactly what the HHS board is, they are a board appointed by the county commissioners. They serve at the pleasure of the county commission, and they serve the Health and Human Services Agency within the county. They're a panel of experts, physicians, psychiatrists, pharmacists, et cetera. Their recommendation comes simply and strictly from a health perspective, protecting the community. That's their job, to advise the county and myself and HHS leadership. And their recommendation was really just about that. Their recommendations also to the community to get vaccinated, and any public sector employer to do the same, around protection of the employee. And to that point, OSHA released, I guess it was June, really, their emergency temporary standard for workplace protection. And they said it's certainly expected, and we see great value in especially healthcare organizations requiring vaccination for COVID-19. So the hospital systems followed suit. They took a while to look at that and pulled the trigger not too long ago. The county itself is still contemplating that recommendation from the HHS board because it's fairly recent. And to be honest, any employer knows the devil is in the details. You've got to look at exactly how we roll this out. We need to give specific instruction on that testing. Are we doing the testing? All of that. All of those details have to be worked out to whatever degree the county decides to take up that recommendation and take it forward, which may look very different and may look very the same. We don't know yet. That's all being looked at. In a general sense, though, any employer, and full disclosure, I'm not an attorney, but any employer with some caveats around ADA requirements, et cetera, religious and medical exemptions that are in the statute, any employers allowed to, if they can connect it to the business, the operations, the requirement to have their people on hand, can ask status of a vaccination, especially given we're in the middle of a pandemic still. Unfortunately, it's not over. And can, for the benefit of the organization, can require, as a condition of employment, as a part of being employed somewhere, ask people to get vaccinated. So that's what's going on, not just with the hospital and healthcare, but other employers, large employers and small, are saying, look, I need to keep things going here, and I need to keep my other employees safe as an employer. So it seems reasonable. For some people, it seems very unreasonable, but the law is supportive of that. With those caveats, you've got to be compliant with ADA and other requirements that are exceptions.
Okay, and I'm going to bring up some of the numbers for the county right now. And while I'm doing that, one thing I was curious about was, are you, from you and I mean public health officials, are you tracking for the cases that are the positive cases happening right now. So here we see the total case count for New Hanover County, about almost 21,000 people overall since last year. North Carolina cases, just over 1 million, and obviously US 35.2 million roughly. So the current cases, when we're talking about the Delta variant, are you also tracking of those which are breakthrough cases, like which are the ones where vaccinated people are also infected again with COVID, even though they've been vaccinated, or is that not being tracked?
So I don't have specific numbers on you, mostly because it's such a rapidly moving target, and the volume of testing and sequencing of the variants would have to be so massive to get really reliable data on that. I can tell you that the rate of cases, we were at 19,000 and change for 2 or 3 weeks. I thought we would never reach 20, 2, 3, maybe even 4 weeks. We were getting a handful of cases per day, single digits, under 10, in terms of reporting to public health of confirmed laboratory cases, tested cases. We have received enough information to know that in terms of sequencing of samples, to know that the Delta variant is here, and we know enough about that it, as I said earlier, it simply outruns the original virus or any other variants. What we track are, as I mentioned earlier, very similar to the state's DHHS 4 metrics. The case numbers, percent positive. The surveillance system that's been in place for a long time is the ED data around typically referred to as influenza-like illness. So any symptomology that comes in is reported, and that has spiked again as well. So all those indicators are indicative of much greater transmission, and the unknowns are what worry us the most. So the cases are rising again. I think maybe the popular perception is that, okay, we know Delta burns fast. Yeah, we're going to see a rise in cases for a while. That's going to burn itself out, and then we'll be okay again. Well, I wrote recently that in an internal communication that if that happens and we simultaneously don't increase the rate of vaccination significantly, and we don't get other more dangerous variants just by random chance, we'll get through the pandemic by sheer luck. And luck is not something we want to count on. So the cases rising may be simply a symptom of the Delta variant moving through the community, but that's not the whole story. There may be, possibly, hopefully, the variants are weaker because they survive and they move through the population fast, but they don't make people super sick. But that's not always guaranteed. We don't know how these viruses may randomly mutate and vary. We may get one that is different. The other risk is that the more variation we have, they may become resistant to the vaccines. And then we don't have that tool in our toolbox anymore. We have to reinvent the vaccine again. And so we start the cycle over again. So that we watch those numbers in terms of they're sort of like just indicators. As I said earlier, testing volumes are down. So we may, the test numbers that we're seeing on this graph, that may only be 15, 20% of the positive cases that are transmitting out there. That's important for people to remember. That's why the governor said, everyone, even if you're fully vaccinated from the CDC as well, you should be masking, protecting yourself and protecting others from the high rate of transmission in public places when you're around people who you don't live with, is basically what it says. And it's common sense, really. If you're around people other than you live with, then the idea is simply to interrupt that transmission as much as possible. So that's the story that we're looking at right now. And things are going to change. This is a problem we're working. It's not necessarily a policy that we can put in place that lasts for a long time. As things change, as we evolve through the pandemic, different measures have to be taken to different magnitudes in order to fight the fight.
And before we go, and since we have this up, let's also take a minute to talk about the age group breakdowns. And I wanted to bring this up because in particular, this was a point of discussion during the school board meeting where they voted on masking earlier this week. And so when they were talking about health metrics in this month of July, when we saw cases overall in the county and the overall population go up, they had some stats that they brought up as well in terms of in the month of July, children ages 5 to 11, there were 20 cases, ages 12 to 17, 45 cases reported. And if we look at this chart in terms of the age breakdown, obviously children, minors under 18 have made up the minority of the age groups in terms of who've been affected and had positive cases throughout the pandemic here. So my question is, what I'm curious about is, again, knowing that it's still been pretty new in our area, but as you see Delta starting to affect our region, do you see any change in terms of its impact on minors, on younger children, or does it seem to be behaving the way we've seen it behave in the past year, where older adults are seeing more positive rates than children are?
So again, unfortunately, we would love to have every person tested on a weekly basis so we could truly have clear vision, 20/20 vision on the virus itself across the community and across the region, really, because we really have a community of several counties, literally. I don't know, I hate to use analogies, but looking at numbers of cases that are documented among an age group is a little like counting cars on College Road by only counting the red ones. It doesn't work that way. If DOT made their plans based on that, we would have a mess, right? And like I said, unfortunately, we'd love to have tests on everyone to have 20/20 vision, but our vision is not 20/20 on any age group. Our vision is also not 20/20 on exactly how the Delta variant or other variants might start affecting young people, a 12-year-old, a 15-year-old, or a 6-year-old versus that 66 or 76-year-old in terms of health status and what it's doing to their system. Hopefully, it's in and out and not doing a lot of damage, but we just don't know. So again, I'll come back to the unknowns. The school board has to make decisions around school. Our advice to them has always been follow the guidance, because the guidance provides you better safe than sorry kind of guidance. Given there are unknowns about the health effects of the virus on those children, it just makes sense. Also, they're doing their role in protecting the community by reducing transmission. So the idea of having everyone mask in such close proximity when kids are in school all day, K through 12. Remember, originally, just a few weeks ago, it was just only K through 8 because teenagers can get vaccinated. And the idea was, well, for a 30% vaccination of that, which I think is where we are, of the 12 to 18-year-olds, we can continue that campaign, get more and more teenagers vaccinated, and we'll be okay. But when Delta showed up and it started burning like wildfire, too many people became at risk. And so the new guidance came out and said, better safe than sorry. Let's stop the transmission, at least in the short term, and have everyone mask in schools so that we can go back to school, so the kids can be in the building and in front of their teacher instead of on a screen. And that's been the school's, from what we've heard, main objective: instructional time to the benefit of the children, even if it has to be with a face covering on.
All right, David, we've kept you on longer than we promised you we would. I know you have a very busy day, but I appreciate you joining us and sharing your insight on some of these areas that are kind of changing rapidly as we're monitoring this. So thanks very much. And thank you to all of you for watching and tuning in to today's Biz Talk. If you want to catch up on previous discussions, you can go to WilmingtonBizTalk.com, or you can find the podcast version of these conversations on your favorite streaming platform. Thanks, everybody. Have a great afternoon. And as always, feel free, if you want to hear from other topics or from other speakers in our community on health and business areas, you can email us at newsroom@WilmingtonBiz.com. Thank you very much.
Thank you, Vicki.